Welcome back, everyone. I hope you had a good lunch and some sun. Now we're going to do a session on trans health, and I'm going to start to present the Swedish Trans Health Study that has a longer name in English. And then Nika Pekarina from Croatia will speak about the situation in the area of the former Yugoslavia. So we're thinking about doing it like this, that I'm going to present this first, and then we do some questions and answers, and then Nika takes his part. So you know. Yeah, so I'm going to present this Swedish public health survey, and it's called Health and Health Determinants Among Transgender Persons, a report on the health status of transgender persons in Sweden. I didn't want to write this because it was so long. And it was released on the 1st of June this year by the Public Health Agency of Sweden. So it's the Public Health Agency of Sweden together with Karolinska Institutet who have written the report. So I'm not I'm not the author of the report. I've been working in the group who worked with the survey and with working with the report and the results together with Vierge from RFSL Youth. And so I have some insight in the study, but I'm not responsible for everything that is in here. So now, with that said, actually I think most of it that is written here is pretty good. It's just that I would have liked so much more to be written. So that's the problem that I have with it. So there is a general public health survey done every year among the Swedish population, which around 20,000 people answers every year. And from 2005, there have been data on the LGBT community. Like they have had questions about sexual orientation. Before this, these questions didn't exist either. And we use this data a lot for advocacy work on promoting LGBT health and also to raise awareness among healthcare and so that things are not perfect in Sweden, even though lots of Swedes, especially cisgender heterosexual folks, think that it's perfect here. Yes, I know. I know. They released the trans study in 2008 also, but this study was very problematic in many ways, so I'm not going to refer to that. So enough said about this. But the general public health study have not asked questions about trans experience or trans identity or gender non-congruent experiences. Until this year, they actually asked this question in the questionnaire for the general public, but we don't have any results from that yet. And since only 20,000 people are answering, probably the population of trans people will be pretty small in this. Yeah, there have been many studies made in, as you all know, internationally. About trans people's health and living conditions and stuff like this. But in Sweden, we haven't had this kind of data on many people before. But we know, of course, that things aren't great. This is not a surprise for us. But it's really important to have this data for advocacy work, to raise awareness among people who think that Sweden is a terrific country for everyone. In 2009, the youth board now it's called something completely else, released a report on young LGBT people's health and living conditions that raised awareness about the situation for younger LGBT people in Sweden. Only here the numbers of trans people who had participated in the studies and so was kind of small also. So it was hard to draw good conclusions. We did a small, very small study in 2010 about sexual health. And it's called Feeling Safe Turns Me On. About 240 people answered this survey. So we have it in Swedish, and for everyone who wants it, we have a small summary in English. And if you want to read the Swedish study, you can download it. So we've been advocating for this kind of study for a long time. Like, we need something bigger and from the state. So we were very happy that when they actually said we're going to do this, and that they included NGOs to work with the survey and the spread of the, spreading the questionnaire. And we reached quite many people. And it was a very long survey, like so many questions. Because we wanted all this data while we were doing it, and now they just used like a small fraction of it to make the report, unfortunately. So if you have questions, please, you can ask them during the talk. I think that makes sense. Yeah, so the way we did the survey was, it was an internet survey that was spread through some advertisements on Cruiser and also Google adverts, but also through Facebook, personal contacts, through trans people's own NGOs, and also through the teams, the gender identity teams in Sweden. So it was spread in very many different ways to reach as many people as possible. But we didn't reach everyone, of course. We had some questions.
I was wondering, you said that they use only a small fraction of the whole data, but is data available?
The data is not available in that sense. It's existing. It's in a database at the Karolinska Institutet. And hopefully they will use the data for more articles. And I know that they have this in mind to use it, but I'm not sure. And I'm going to push for them to actually use the data, because we have so much good information and also comments from everyone who answered the questionnaire that are really should be made public in some way, because we're gonna use. I have some of the comments, and we can use it in educating healthcare and stuff like this to make quotes from trans people in Sweden. But we need more research done on this data. But the thing is, with this survey, it was uppdrag. The task from the government was to make a public health survey among trans people. So this report reflects the general public health survey. It's the same questions that they have picked for this report. So 800 people responded. 46% were assigned male at birth. 49% were assigned female at birth. There were many different trans identities, and you could choose more than one. So things are not adding up to 100 all the time. So you can see there were 37% who identified as transsexual, 35% as intergender, 16% as transvestite, 6% as ex-transsexual or former transsexual, 13% had put something else or were unsure. And most of the others were, genderqueer, non-gender, agender, this kind of non-binary identities. And we also asked for gender identity. And here, of course, you could also choose more than one. So 26% considered oneself woman, 36% considered oneself man, 26% both man and woman, 26% queer, and 23% neither woman nor man. And we asked about a gender marker and a change of juridical sex, because we think that has an impact on health. Like, if one have gotten access to it, if one needs it, or if one wants to change juridical sex but doesn't have the opportunity because we only have 2 different juridical sexes in Sweden at the moment. So 14% had changed gender marker. 38% wanted to change the gender marker. 20% doesn't need to change the gender marker. And 26% said they cannot change because the preferred gender is not available. So this is also kind of a new data that we didn't have before. Like how many people would actually like a third gender marker or a non-gender option. So the problem is that they haven't used this data for the interpretation of the results. So we cannot say like, is the health difference if you're in one of these different groups? There was like in the draft of the report there was like data on this, but they removed it to this report, which was very, very sad, because it was clear, not clearly, but it was what do you say, suggesting that this does actually make a difference, like if you have access to legal change or not. About age, yeah. Sorry?
Do you have a cross-tabulation, so a link, so to say, between the legal gender marker and the gender identity?
Yes, we do, but it's not in the report. But I have it.
Those, the 26% who cannot change because of a lack of a third, how did that relate to gender identity categories? Were that
like
people
it's mostly non-binary identity, many assigned female at birth. But not all, of course. And regarding to age, we saw the same as in the European, the FRA study, that we reached young people mostly. And this is, of course, due to the way that we spread the survey on like Facebook and Cruiser and those kind of places. And also it also reflects like friends and friends of friends and friends of friends of friends of ours, since we spread the survey this way. So that's a bias in the result. And also, of course, since we did this internet survey, we cannot draw conclusions for the whole population through this survey, because it's not, what do you say, statistically representative sample. But you can never, like, it's hard with smaller populations to get statistical representative samples. But it's at least it's a quite big study. Like if you compare it to the American discrimination study that was made, they had 8,000 respondents, and they're 319 million people. So they only had like 10 times more people answering their questionnaire, but they have like, I don't know, yeah, 30 times more people. So we're pretty content with the number. And it's not happy, the results. And we knew this, but we're going to use it for good things. But I'm going to give you depressing data for a while. Bear with me. We asked about if one had experienced discriminatory or abusive treatment in the last 3 months. And in the European study, you asked for 12 months. Yeah, but this was the last 3 months, and 58% said yes. And 25% said yes many times. So if you compare it to, which you cannot really do, but yeah, you can, it makes, if you compare it to the general public health survey, it's 3 times more, this number. And 54% in the EU in the last year. So Sweden is worse than the rest of the EU. Yeah, it seems like that. And we asked also by who, like who treated you this way. And it's mostly made by a stranger or a close person, a person on the internet, or a friend or acquaintance. So it can be someone totally random or someone very close to you. And other people, like we had the long list, but these are the most common ones. We saw that there is very low trust for the general, like health and welfare and society net. What do you say? Safety nets and stuff like this, like the police, like non-employment. I don't know. Oh, yeah, institutions, stuff like that. And we can see that this is also the case for lesbian and gay and bisexual people. Like the trust is lower than in the general population, which is not so very strange if you see the next slide. 19% say they have experienced violence because of trans experience at some point in their life. 7% have experienced physical violence in the last 12 months. And 25% of these were by the police. So it's not so strange that people are not trusting the police, for example. But also there can be a stranger who does this to you or your partner. So it's both like close people and complete strangers. 30% also have experienced some kind of non-consensual sex, which is, yeah, very problematic. And if you compare it to the general population, is The number who have experienced physical violence the last 12 months is 3%. So it's double in this sample. And when it comes to mental health and suicide thoughts, we know this. This is not, well, like, we're not surprised, but it's black on white numbers to give to the authorities. Hello, we have to do something. We knew this, but it's pretty clear that we need to do something. 36% of all the people have had suicide thoughts during the last year. And if you look at the age, like the younger group, this number is 57%. And it goes through the whole sample, that the older you get, the better you feel. Like, it's pretty clear from this study, but it's the only background factor they actually checked for also. But it's visible that older people tend to have better health, both mental and physical health. And if you compare this to the general population, it's 6% who had suicide thoughts the last year. So it's 6 times higher, this group. And 33% have sometime in their life attempted suicide, which is also very, very, very high. And this is, yeah, the best country in the world for LGBT people. Yay!
Hi,
Hey.
My name is Signe, and I just have a question on these background facts. Do you have any information on, like, in relations to economical issues or people of color or so, if that relates to the health?
Yeah, of course it will relate to health.
It's not included?
It's not included. It's only age that they have looked for, like correlations. We have background data, like income, and if you're born, where in the world you're born, and stuff like this. But they haven't reported on it, which is problematic. And it's also a fact that this survey was really long, and it was in Swedish. Kind of like hard to grasp Swedish, I would say, because we wanted to make it inclusive, and then it's hard with words. So I think we didn't reach the population of trans people who are not Swedish speaking or like haven't been in Sweden for a long time. But I hope that this will be factors that are like looked upon more thoroughly. Because it's important, and also like different, like it can be differences if you were assigned male at birth or female at birth, but they haven't looked at it, unfortunately. What else?
I also wanted to ask, did the survey go so deep to investigate whether the suicidal thoughts relate directly to the gender identity of the person, or was it a more general?
Yeah, we asked
factor?
the question about this, and I don't remember the exact answers, but we have a fair amount of people say yes, it has to do with this, but a fair amount of people say no, it doesn't have to do with my gender incongruence or gender identity. But I don't think it's in the report. Sorry, we need to use the microphone.
I think it is in the report. I just looking at it on page 41.
Good.
18% say they try to commit suicide because of their trans experience, and 72% said partly because of their trans experience.
Yeah, thank you.
I just want to give information also about situation in Russia. Maybe some of you know that in Russia is the first country in the world of suicide, and there is a statistic that Russian LGBT teens usually commit suicide 5 times more than their heterosexual teens. And if I really advise to everybody to visit project Children 404. It's like not founded page in internet, and it's a lot of stories about Russian LGBT teens. And if you will visit this page, you can see situation with LGBT rights in Russia also.
Thank you very much. Yeah, and also about income. As I told you, a lot of the people who attended or who participated in the survey are young, and also a lot of people are studying. Yeah, and I don't think they have done the same kind of weighing as the European Union survey did with income in that way. Yeah. So if it comes to general health, then 50% think they have good or very good general health. So that's a good sign. And 30% are content with their life in general. And also you see that the contentment increase with age. People in older age groups are more content than younger ones. And we actually got in some questions about sexual health. In the public health survey, there are no questions about sexual health. Don't ask me why. Because I think it's a very conservative public health institute who has been doing this research. And now, yeah, in the 2015 survey, I think there are some questions on sexual health, but not so many. But we got some through. And when it comes to sexual health, 23% say that they are happy or very happy with their sexual health. And 33% say that they're not happy. And the rest are somewhere there, in between. 38% have one ongoing sexual relationship. 14% have more than one ongoing sexual relationship. And 34% does not have a sexual relationship at the moment. But this doesn't, of course, mean that they don't have partners, or we have asked questions about that as well, but it's not in the report. And if it comes to HIV, like in a global context, HIV is an important topic when it comes to trans. So we asked about some issues on HIV. 46% say they have never taken an HIV test. So, yeah, it's a bit too little, we would say. And you can come to RFSL and do it if you live in Stockholm. We're open on Mondays and Tuesday nights, so if it's time. One person reported to be HIV positive, so it's kind of a low prevalence in this group. And 63% say that they know about a clinic where they can get a test for HIV and get good treatment. Or treatment, bemötande in Swedish. I don't know what you say it in. There aren't any good words, but like good welcoming, or like the way you're treated during the talk. So in conclusion then, this is nothing new to us. But hopefully we can use this as an awakening for healthcare and politicians. I think we've reached in Sweden we reached the what do you say? The awareness among healthcare that there are things that healthcare doesn't know about. I think that's the level in Sweden now, that they realize that they need to know more. But the next step is not there yet. It's evident that age is a very important factor, and we need to work with youth. But also the other background factors have not been investigated in this report. So we don't know about the other background factors. And we're going to use the results for advocacy work and like, hey, it's time for action. Like we've been doing, like RFSL, RFSL Youth, FPS, KIM, like a lot of organizations are doing lots of things for trans health. But there is almost no funding to continue doing the good things that are already happening. Like Transformering, for example, the homepage, which is very, very important, lose the funding because it's not a new and spectacular project anymore and stuff like this. So we need to work on many different levels. I think we both need to change society, but at the same time work to create safe spaces, support, and like to find your bubble to be safe. Like if you live, like we work with, in RFSL, we work with crime victim support. And one, like if you're subjected to violence or partner violence, like one major thing is to get away from that relationship. But if the whole society is a violence relationship, you need to find other ways to get out of there except for suicide. So this is what we need to do. Yeah. Thank you. Are there questions, comments?
So you said there was this big difference in age and the problems faced by youth, but you only talked about suicidal thoughts and suicide attempts, which in general is very much related to being teen. I mean, that's in every study on mental health, you see that youth is very much prone to this, so it's not a trans-specific issue. Did you see such a difference in age related to other health aspects as well?
In almost every aspect. Like, yeah, we saw that. And I just picked out the most important topics. There are like the same patterns goes on for almost every issue. Yes.
My question relates to that. If there is such a huge impact of age, but there was no control for other socioeconomic background variables, we actually can't conclude that age is such a determinant factor, because it might be income, it might be education, it might be the household composition of the person. There might be many different explanational factors that might shed a different light on the findings, but if it's a good scientific report, it must take into account all these things, especially age, education, income, and stuff like that. So
tell me about it.
Yes. So I was wondering how come that this report, and the first question, is this report published yet?
Yes.
So it's available online?
Yes.
And
we also have a few copies over there if you want.
Okay, and it's published by a scientific institution?
It's published by the Public Health Agency of Sweden.
Okay. Strange.
Yes. We think so too. Like, I was surprised that they only took age into account. Yeah.
following up very short there, do you know anything about why they left out all the things that could have been in the report because it was in the survey? Or?
I think maybe, I don't really know, but I think maybe it's because age is like the main division in the public health survey as well, like the general one. So I think maybe that's why, but I can't tell you more about that. And also, I think time was an issue because they needed to report to the government at a certain time.
Are there any more questions? Okay, I also have one too.
Even in Sweden, it's very pity statistic that a lot of LGBT trying or committed suicide. And my question is, do you have in your plans plan to make support and help service for LGBT who want commit suicide?
There are quite a lot of things happening in support-wise, but not enough. For example, we don't have funding for psychologists or like therapy that people might need. I think this is a very, very important step for like providing trans-competent psychological help. And also funding for the things that already exists, like the trans camp, like support groups, stuff like that.
I might just ask, are there any plans or proposals to do a follow-up study from this, like in the coming years, or was this sort of a one time only in as far as you're aware? Because obviously it's great that there's this survey and this results, but then in relation to then seeing progress or seeing if there are additional issues that come up, then that it's not just, yeah, well, we ticked that box, we did the trans research, so that's it. So are there plans for a follow-up as far as you're aware at this stage?
Not as far as I'm aware, but the Social Board for Health and Welfare have gotten assignment from the government to be the LGBT, I don't know, authority in charge of LGBT issues, like to be sammankallande or organizing the work on LGBT issues in Sweden. So, and I think this is more a long-term assignment for them. So I think in a few years it's going to be possible to advocate for one more, but I'm not sure if it's in their plan or not. It should be.
Hello, my name is Lena. I live here in Stockholm, and I have a question about this survey is only on living people, but those who already done the suicide, do we have a statistic of age representative for? But we don't know if they are LBG or why the reason is. But I saw one study in England. Where every time when a young people is making suicide, they try to find out if it was a transsexual or a homosexual person.
Okay, I know that Cecilia Dana has done a follow-up for transsexual people or people with the transsexual diagnosis to see what happened after diagnosis, and it's evident that even after diagnosis, the suicide rate is 3 times higher than the general population. So we do know that this is a problem or like a thing that exists even if you get healthcare and treatment, and that you need support after a process as well.
In that aspect, it's maybe interesting to know that in Canada there has been a very large research transpulse research project, and just this week they have published a report on suicide experiences of trans people, linking it to social acceptance and social life of trans people. Their conclusion was that because of the discrimination and violence experience that trans people have, even after transitioning, that is clearly linked with the suicide attempts. So because of being in this minority position within the society. So, and if I may, I had another question. I understood it right that there is a report specific on the trans respondents.
This is only trans respondents.
Yeah. But it was part of the larger...
No, this was a totally different survey.
Okay.
Because the larger one doesn't reach the trans population at all.
But it was in 2015 that they now included the question.
Yes.
Okay.
Yeah.
Because I think that would be very interesting to have a comparison.
Yes.
Because in one survey that we did in Belgium, we also had a comparison between cis and trans people with the same questions. And this is especially interesting for the government, because then they can see what is so specifically different for trans people compared to non-trans people. And what is maybe just a matter of age or a matter of income. But so the trans-specific issues become very clear if you can do a comparison. Yep. So if there is this question now, I think you probably would be better start lobbying already so that the next report that would come out makes this comparison very clearly for you and for the government to work on.
They do it when it comes to LGB already, and there's a specific report on that. So hopefully, if enough trans people answers, there will be also about transgender or trans.
And do you know anything about the kind of questions that they have incorporated in the survey design?
Like yes.
Because that really is already an indicator of how many trans people you will reach. There was a study done in Flanders, a study on sexual health. So it was a representative study, so the general Flemish population could take part. And they incorporated one question about gender identity for every respondent. And the question was on a scale from 1 to 5, like how do you identify from female to male? And it was the same thing that they once did in the Netherlands. And because of this representative study, they could conclude that 0.6% of all the Flemish people identify more like the other gender than the gender assigned at birth. When you take 0.6% of the Flemish population, you have a population size of 30,000 people, which is, you know, the amount of trans people visible in the Flemish population is around 200. So you see the difference. If you would ask, are you a trans person? It's a totally different question. If you would ask every respondent, what about your gender identity? And I think this kind of awareness of what kind of questions you can use is very important, because it will totally color the results that you can get.
Yeah, it's a good point. Yeah, but at the moment, the survey that is gone out now has the question: do you have a trans experience, or do you consider yourself trans? Something like that. So yeah, it's a good point to try to change that maybe. Okay, we need to move on. So Nika has the opportunity to speak as well. But I think maybe we take 5 minutes peeing and stuff like this, and then Nika will start.